The adverse effects of the COVID-19 crisis in the Bahamas led to scores of residents seeking mental help. Clinical psychologist and director of psychological services at the Sandlands Rehabilitation Center, Rochelle Baston, says high rates of anxiety, depression, and acute stress were some of the mounting problems diagnosed at its outpatient and counseling center on Collins Avenue.
So initially, also those numbers were, they didn't see an increase in the beginning, but during the second wave, and people were, beginning to experience some of the impact of the lockdowns, the shut-ins, the not having everything available to them that would have been there before, and some of the anxiety related to the virus and the illness itself. And so, yes, they've started. I can't give you numbers, but certainly there has been a noticeable increase at the outpatient clinic. Now, part of that is also because we have had a lot of the other clinics that would have operated at other locations, like the Princess Margaret Hospital, for instance. Those were relocated, and a few of them were relocated to that setting, and so that would have also contributed to the increase at the outpatient level.
Now, to meet the huge demand for counseling services, the psychology department at the Sandlands Rehabilitation Center introduced telepsychology counseling through Zoom and other virtual platforms. Also, counseling services at the Sandlands Rehabilitation Center were transferred to several of its community clinics.
So there's been a lot of requests for stress-related conditions, acute stress reactions, because remember, we were just coming off of dealing with the aftermath of Dorian, and so stress levels were already high. And so people were already seeking intervention and somebody to talk to because of the high levels of stress that they were experiencing secondary to Dorian. So once some of the restrictions were lifted and people were able to, had access to move around more, then they started showing up, or they started calling the helplines. Because the other thing that we did in the psychology area was to partner with the Bahamas Psychological Association in the provision of helplines that people can call, including a Creole line that people can call to say, to share, to talk to somebody, to say what they're going through.